And welcome back. Dr. Mark Simpson with Simpson Dental Associates joins us now to take your calls. Here's a number on the screen if you want to give us a call and ask Dr. Simpson a question. It's 304-342-6162. And you know, a couple weeks ago we talked about oral cancer screenings and how important they are.
It is. It's important you have an annual screening for oral cancer. And a lot of people that have dentures think they don't need to have that, but that's a group of people that have a tendency to have higher cancer rates. But also there's a group of people, young adults between 20 and 30, that are having a huge increase in oral pharyngeal cancer caused by the HPV virus. Now, this is a sexually transmitted virus, and they claim that up to 90% of the people will have this virus sometime in their life. But the important thing is that young people between 11 and 12, males and females, should get the vaccination. That's what the medical community is recommending. So it's a way to help prevent the cancer.
Number 90%?
It is. It's amazing, but it's very, very, very common. A lot of people, their bodies can handle it. That just sheds the virus, but the one particular HP16 is the one that they are tying to cancer.
How do you know if you have that, doctor? Is it like a lesion or something?
You can have like a little wart sometime, but a lot of times you don't even know that you have it, so that's the scary part. So the vaccination is the key for young people.
Let's also, before we get to our calls, let's talk about how important it is to follow a daily routine and how that can help prevent diseases as well.
Well, the key is that the bacteria live on a 24-hour cycle, and so what happens, you have to knock them off every 24 hours. Brushing alone will not do it. It only gets about half of it.
All right. We do have our first caller right now. Sandra is on the line. Hi, Sandra.
Hi.
How can we help you?
Okay. I have, just the past couple of weeks, started to have some tooth pain. It's a jaw tooth on my left side.
Okay.
Bottom. Okay. Now, it had been, you know, hurting to where nothing great, but I knew I would have a little toothache, just a dull toothache. The past couple of days, it actually had gotten a little bit worse, but yesterday afternoon, we were in the vehicle, and it hurt so bad. I had pain down in my chest with it. My whole front bottom teeth also has hurt the whole time with this. It feels
well,
like
what are you waiting for? That's my question.
Well, okay. And the other thing, well, what scared me yesterday was it got under my neck, pain, the jaw pain, of course, the toothache. Teeth have been hurting from that jaw, from that tooth all the way around to the front teeth. And my arm, I had pain clear down my arm and my hands.
Well, there's two things that you need to be concerned about.
Can that happen? I mean, can your teeth do that?
Absolutely, it can. And obviously you need to go get your tooth checked. But what other thing can cause those similar symptoms is a heart attack. So, you just described what a lot of people experience even with a heart attack. So, who knows? You may have had a mild heart attack for all I know. But one thing I can tell you is that as soon as you have tooth pain, that's the best time to go get it checked out. Because the coming and going of the tooth pain, a lot of times that indicates that there could be an abscess. So you need immediate care, maybe from a dentist and a physician.
And sometimes with abscesses, you have to go into a root canal, don't you?
That's usually the solution unless the tooth is lost. I do want to invite everybody to our seminar May 5th. If you call the number 342-6162, you can get one of the slots. We've had great turnouts for these. People are loving them and coming out on a regular basis. So join us.
All right, sounds good.
Thank you so much.
Thank you, Dr. Simpson.
It's always a pleasure.